Hi, I'm Becky Needles. I am a DNP student at Franklin University, and I have an exciting project to tell you about that's important to improve the health and safety of our patients. The project that I am focused on for my DNP is to reduce inpatient falls on the 3 med unit and a mid Missouri hospital. This is the project that will be to complete my DNP, and I'm excited to get involved and to help these patients to reduce the incidence of falls and injuries and all the costs, financial and otherwise, that are associated with this problem. So let's get started. So, the overview of this project is through recent literature, it is well known that a multifaceted approach works best to address patient falls and to reduce them. So, we're going to look at 3 different things that we're going to implement over a 12-week period in the hopes of reducing falls for these patients by 5% in the 12-week period, starting here in a few months. So let's discuss these 3 things. First of all, we want to look at a patient fall risk education sheet, a tips sheet. This is popular throughout Veterans Affairs. So at this hospital that is owned by Veterans Affairs, I think it will be crucial in implementing and bringing it here to show that our hospital can implement something that's effective at improving this patient safety issue. So a tips sheet is telling patients you're now at a high risk for falls now that you're an inpatient, and to help them and their families understand, okay, things might not always be working the way they normally do. And we're going to let you know that so that you don't try to get up and do things the way you normally would, but you might reach out and ask for help instead. The second part of the project is to review the policy of logging in and out of communication devices during shift change. Data found that a lot of patients were falling during shift change, and after further research, it was found that patients are only able to communicate through staff during these communication devices. So, call lights, bed alarms, chair alarms, um, any patient center messages, those all happen through the communication devices. So we need staff to be logging in and out at the same time. So when outgoing staff are leaving, they will log out, and incoming staff will log in so that those messages are still going to staff. And there's no gaps in coverage where messages are being sent, but there are no devices logged into, so that no messages are being received. The third thing is a post-fall huddle. Of course, post-fall huddles are important according to current literature to reduce the risk of patient injury and also repeat falls. So what this is all these stakeholders come together involving right after the fall takes place and saying, what happened? Can we fix it? Let's fix it. So, for example, if there's water on the floor when a patient falls, okay, did anyone clean it up? Let's clean it up. And then we don't have to worry about that patient falling and slipping in that water or that wet area again. So, those are the 3 things for this project. The goal or aim again is to reduce patient falls by 5% in a 12-week period for this 3 med unit at this mid Missouri hospital. Will be accomplished through a PDSA cycle. As we know, PDSA cycles are effective at identifying outcomes, and we can collect data, look at the data from that cycle, and see what worked and what didn't, and then immediately implement that change. And if it does work, we want to, of course, implement it on a larger scale. The outcome measures used to evaluate the results, real quickly, are just looking at the data that we collect during the PDSA cycle. So we want to know during that cycle, how many patient falls did we have? What was it attributed to? Was it related to or involving any of our 3 actions that we're planning on doing during that period? And just collecting all that data and then comparing it to the data that we have already collected before this 12-week period. So then we'll easily be able to see, was this project effective at improving patient safety for these patients? Thank you all for listening. I'm excited to get started, and I wish you all well as you continue to look at patient safety issues in your area. Thank you. Have a great day.